Welcome to Business Spotlight, everyone. I'm over here with Dr. Keith and Angie from Tier 1 Health and Wellness. Today we're talking all about hormones. It is what it is. Welcome to the show, my friends. Okay, now before we get into it all, I want everyone to understand at home that when we are low on hormones, that we get restless, we get tired, we feel like we haven't had a great night's sleep. Our sex drive is down. We're feeling older than what we actually are, right? Are they the things that you hear the most of when people come into your clinic? All right, of course, what are we talking about? Hormone optimization. What is hormone optimization, doctor? Well,
as we age, our hormones naturally decline, and with that comes symptoms. So what we're trying to do is maintain those hormone levels at in a healthy range to help someone feel their best, function their best, perform their best, and be their healthiest.
Well, how do we know? I said some of the symptoms: tiredness, sex drive, lack of energy. How do we know that we are low on hormones?
We look at symptoms, as Keith said, but we can also draw blood to kind of see where you are and get a baseline level, but symptoms really tell us a lot.
Okay, so what are you looking for when you draw blood and you're looking at the symptoms?
Well, for instance, a postmenopausal woman, she's going to be at 0 already in progesterone, estrogen, and testosterone. So they go through endocrine failure. But if you take a middle-aged individual that's having symptoms, then we'll obtain laboratory studies and see where their hormone levels lie and see if that'll correlate with their symptoms.
Okay, well, let's just jump across and think about what are the benefits of hormone therapy?
Benefits of hormone therapy are just helping us to maintain levels, which really helps to preserve a better state of health.
Yeah.
So we're looking at decreased insulin resistance. We're looking at, most people come in for the feel good now benefits of better energy level, better sex drive, those kinds of things. But we're looking at long-term benefits, helping to prevent a lot of the degenerative diseases that go along with aging.
Thank you. Right. Thank you. That's the important thing. Look, I remember I had a lot of tests when I was younger. I was probably about 25, and the doctor did a testosterone test. And I thought, well, that's a bit young, don't you think? He told me I had the testosterone level of a 75-year-old man. I almost fell off the chair, and I got scared. And I thought to myself, what's he going to make me take? Because I was told testosterone, when you inject it, isn't great. That's not true.
No, it's not.
Explain that myth.
Well, testosterone actually will decrease visceral body fat, which is the dangerous body fat that we have. It's directly responsible for at least 13 different cancers. It'll increase lean muscle mass, it improves cognition, it creates stronger bones, it improves your lipid profile, so it should be used by a cardiologist just to do that. It's just a wonderful hormone to improve men's health and women.
And that's what I was just about to say. We're talking about men and women here, so different treatments for different sexes, I would assume.
Mm-hmm. Absolutely. We look at each one individually, but we all need most of the same hormones.
So let's talk a little bit about the process. Let's just say a typical guy, mid-50s. What would be his expectation of what would be needed to have done? Now, we know there's different levels of hormones that he would need, but walk us through that process.
Well, he would need a physical exam, of course, and then he'll have a symptom questionnaire, and obviously he would be there for a reason, such as fatigue, irritability, depression, weight gain, lack of libido, all those symptoms, and then we do a measurement of his serum levels of his hormones, and then we would do a trial of supplementation.
And that's very similar to women too.
Absolutely.
Look, I think you two are amazing. I can't wait to find out more. We're going to have you back. We're going to talk about many more things that you're doing over there. We appreciate you. If you want to find out more information, there it all is up on the screen for you. Tier 1 Health and Wellness. And of course, they can help you if you're feeling tired, a little fatigued, or you just want to have that pep in your step. Back after this short break.